So today I will share my like uh, my topic related to community mental health. So the outline will be global view of mental health. Okay, mental health in Malaysia and also the community mental health. So for global view on the mental health, we can see that globally, hundred of million of people are affected by mental illness, and estimated about 300 million people are affected by depression, and it is one of the leading causes of disability worldwide. And for every years, almost 800 people die due to suicide, leading cause of death among 15 to 29 years old. And these cases are globally. Okay, and then for every suicide, there are the countless families, friends, and communities who are left behind and who experience a long-lasting effect of such tragedy. So this reference from WHO. Okay, for mental health system in Malaysia comprise of elements which are fundamentally crucial for quality healthcare, which are appropriate, accessible, self-responsive, patient-centered, effective, and also affordable for patient. So this mental health system actually to reduce the stigma and also to encourage public to seek treatment as early as possible. And then the primary care will focus on mental health promotion, early detection and treatment, a follow-up of the stable mentally ill, and also for psychosocial rehab and the family intervention. So these include outpatient, inpatient care, or psychoeducation program, rehabilitation services, community mental health care center, or psychiatric nursing home, and also the family intervention. Okay, from government mental health services in Malaysia, we have psychiatric specialized hospital. So in Malaysia, we have Tanjung Rambutan and Hospital Tampoy, and also we have the psychiatric unit in hospital. For every hospital, we have a psychiatric unit. And then actually to reduce the referral to the specialized hospital, and also to increase center and bed at psychiatric unit in hospital. And then for primary health care, the health clinic for outpatient and also for rehabilitation program, to empowering the family physician for health promotion, early detection, follow-up of stable cases, and also for defaulters tracing. So for psychiatric unit in hospital, there are community psychiatry for early discharge program, assertive community treatment, and for relapse treatment. And we also have community mental health center, or we call Mentari program, Mentari services for psychoeducation, promotion of mental health, screening for early detection, community mental health team, supported employment, and also for social enterprise. And then we have the psychiatric nursing home see in planning. Okay, for mental health services in Malaysia, we can see the services, the psychiatric special hospital. We have the psychiatric unit in hospital, also the primary health care. So community mental health center, or we commentary, the psychiatric nursing home and health clinic, and also for outpatient and rehab. Okay, community psychiatric services actually the an extended services from respective hospital with psychiatric services. For example, in Pahang, we have Hospital Tengku Ampun Awzan. We have this hospital. We have a psychiatric unit. This hospital actually the hospital that your friends or your senior went for their mobility program last year and before COVID. So they have chance to take care the mental health patient in different environment, different setting compared to your country. It is a very very valuable experience that they get from the mobility program. Okay, and then the community secretary services also, we had the paramedic secretary team to visit patient at their home for home visit and to minimize the defaulter rate by ensuring the compliance to treatment and counseling to both parents, patient and carers, also providing support to patient and families to health education and also counseling. So we can see this table shows that the highest number of community psychiatric visit in Ministry of Health Hospital in 2015. The highest was in Johor, because Johor they have specialized psychiatric hospital. Okay. For community-based specialist mental health services, we call Mentari, is basically community mental health center which was launched in 2015, and the aims were to reintegrate patients with a serious mental illnesses using work-based therapies and also preventive treatment for individuals having early symptoms. This center actually managed by psychiatric and mental health department of respective Ministry of Health hospital. For example, in Pahang and in Kuantan, the Mentari services was located at KK Klinik Kesihatan Balok. They are still managed by Hospital Tengku Ampuan Afzal Kuantan. It is the distribution of community-based mental health center or Mentari in Malaysia. We can see that in Pahang we have two, Kuantan and Mentakab. We have one in Melaka. We have two Johor. Okay, not every there is every state they have the Mentari services, but they will refer to the main hospital, to the government hospital. Okay. So in Pahang, we have Hospital Tengku Amzan, we have Mentari Balo, and Hospital Sultan Haji Ahmad Shah, Mentari Mentakab. Okay. So we can say that the community health center or Mentari services actually is one of the innovation in psychiatric and also in psychiatric nursing. Okay, so because the integration of mental health care into primary health care and the community-based psychiatric services. Okay, these are psychiatric unit in hospital, innovation in mental health for rehabilitation. So, this one we have group therapy or psychoeducation therapy, and we have the counseling room, and this area we use for rehab program. We have indoor and outdoor activity. Okay, so this psychiatric unit in hospital Tengku Ampuan Azan, we have unit rawatan psychosocial, so they will do all the occupational therapy and also the psychosocial therapy. So this is my student. They conduct psychosocial activity. So this one for outdoor activity or exercise. Okay. Okay, these are the community psychiatric. So the psychiatric team, they will go to patient house for home visit. So to minimize the defaulter rate and also providing support to patient and family. okay, this your friends also they had an experience for home visit. Okay, they follow the psychiatric team for home visit. Okay, and then also to give medication to ensure they are complying with the medication. Okay, this is the Pusat Rawatan Komuniti of Mentari Balok. So they every Monday to Thursday they went for clinical posting to take the case, to take the assignment, to have the experience, care for psychiatric patient in different setting from your country. So I think this is very valuable experience for them. And then on the Friday, they will present the case that like we did now. Okay, and then the unit rawatan psychosocial at Mentari Balok. Okay, and then they will do the routine observation. Then when patient went to the Mentari Balok, they will do to check the blood pressure and so on. So the health clinic, or we call the methadone clinic, was located or was in the klinik kesihatan. Okay, klinik kesihatan. This methadone program actually as one of the program to reduce the addiction of the drug addict, and also to reduce the risk of infection among them that use that share the same needles. Okay. Better retention of Malaysian opiate dependence treated with high dose methadone therapy. So this is one or one approach. We can see the innovation in mental health care in Malaysia, but I'm not sure in your country. Um, so this is the apa, uh, memory, the sweet memory by your friends or your seniors, so they have a chance to visit our faculty, as also to have experience care for psychiatric patient in Malaysia. I think we must pray that all the we must pray to for uh, for COVID-19, so that we must pray that COVID-19 will dissolve from our earth, so that we can share, so we can have experience to share our knowledge and our experience between two countries. Okay, so I think that's all for my class. Thank you very much. So if you have any um, problems or you have any question, you can always ask me. Okay, because we will have our case conference later. So I hope that you can mm, understand, uh, and also hope that will help you to understand the different setting uh, for mental health services. Okay, I think that's all. Thank you very much, and see you on the in the next class. Assalamualaikum.